Do I need Medicare at 65 if I have employer insurance? Imagine reaching your 65th birthday and wondering if you need to sign up for Medicare now or wait. It's a common question for many approaching this milestone. If you have health insurance through your or your spouse's job, you might think you can skip Medicare. But the answer depends on a few key details about your coverage and your employer. First, Medicare Part A, which covers hospital stays, is usually free if you or your spouse have enough work credits. It's a good idea to enroll in Part A at 65 even if you keep your employer insurance. It helps cover hospital costs and works well alongside your employer plan. You don't pay a monthly premium for Part A if you qualify. Medicare Part B, which covers outpatient services and doctor visits, can be delayed without penalty if you are actively working and covered by a large employer plan. A large employer is one with 20 or more employees. If that's your situation, you have an 8-month period after you stop working or your employer coverage ends to sign up for Part B. This is called a special enrollment period. However, if your employer has fewer than 20 employees, Medicare becomes the primary payer once you turn 65. That means you should enroll in both Part A and Part B at 65 to avoid coverage gaps. If you don't enroll when first eligible and you lack other qualifying coverage, you might face late enrollment penalties. If your current insurance is COBRA or from a small employer, it's often better to enroll in Medicare at 65. Doing so helps prevent penalties and ensures continuous coverage. It's always smart to check with your employer's benefits administrator to understand how your coverage works with Medicare. Remember, if you decide to delay Part B, make sure to sign up during your 8-month special enrollment period after your employer coverage ends. Also, if your employer plan doesn't include creditable drug coverage, you should consider enrolling in a Medicare Part D prescription drug plan to avoid late penalties. In summary, if you're still working with a large employer and have good coverage, you can usually delay Part B without penalty but should consider enrolling in Part A when your employment ends. Use your 8-month window to sign up for Part B. Always double-check your specific situation with your employer and Medicare to keep your coverage seamless and avoid unnecessary costs.